Tuesday, January 21st, 2020. Our first agenda item is RS 2020-165, Mendez, Hurt, and Others. It's a grant from the Tennessee Department of Health to the Metro Board of Health to provide HIV, STI prevention, surveillance, and PrEP clinic services.
Motion.
Second.
Thank you. It's been a motion and properly seconded. Are there any questions or discussions?
Our standard HIV, STD grant. STDs are not going in the right direction. It can't get here soon enough, the money.
Okay, now I have a problem because I need to abstain from this grant, from this bill, which means we won't have
A quorum?
a quorum.
Yeah, we will.
I don't
Even
count.
Oh, you don't count?
She's not, yeah, she doesn't
Let me go
count
find
this.
the committee. I would love to be.
No, you got to call.
I love it.
Yeah, no. You can abstain.
I can, but it's still,
It's still a quorum.
Yeah,
it's still a quorum?
Yeah, you can abstain. We don't need Renee to vote.
Still a quorum with
As
you
long as
here.
you're here.
Okay.
And in command, with your command presence.
Yeah. Get Jenny.
Well, absolutely, I think the bill should pass.
Rarely there, you not know. I got it. And then
No, we don't need it. We don't need no person. She can abstain. It's still quorum.
Okay. Well, just, I wanted to be clear.
oh, maybe so.
All you
that's
need
true.
is just a person.
Okay.
She doesn't have to vote. She could even no vote.
Okay, I just wanted to be clear. You're right, it could be a no vote and it still passes. So, it's already been discussed. Any questions, comments regarding the bill? All in favor?
Aye.
Any opposed? There being none. 1, 2, 3, 4. Okay. The next bill is Resolution 2020-166. It's a grant from the Tennessee Department of Health to the Metro Board of Health to provide public health activities to enhance the health and well-being of women, infants, and families by improving community resources and service delivery systems available to them.
Motion.
Second.
It's been properly moved and seconded. Mr. Sharp?
That is the fetal infant mortality grant. This program's been in place for a while. It allows them to review medical records and any other kind of records that they need for every death of a child under a year old in the county, in an effort to try to assess what happened in that particular situation, see whether the system needs to be modified to try to avoid that. I will tell you that, as of, for instance, the National Strong Babies grant that we got from the feds back in the spring, last spring, was largely driven by the data that those people generated.
Awesome.
Targeted at the places that need it most.
Great. Are there any questions, comments? All in favor?
Aye.
Any opposes? Thank you very much. Our next resolution is RS 2020-167, Mendez, Hurt, and Hancock, accepts a grant from the Tennessee Department of Health to the Metro Board of Health to improve the health of the citizens of Davidson County through targeted strategies to prevent and control the use of tobacco.
Motion.
Second.
Mr. Sharp.
We've got 2 pots of tobacco use prevention money that come in. This is the smaller standard one that's been coming in from the CDC indirectly for some years. And it's primarily education. Smoking's bad for you.
Okay. Any questions, comments? All in favor?
Aye.
Any opposed? Thank you very much. Well, we got 2 more. This next resolution is RS 2020-174, HURT, which encourages employers in Davidson County to provide a workplace wellness program for their employees. So this is basically just
Motion.
Second.
Councilman Hurt, would you like to explain your bill?
I'm sorry. Motion. Is there a second?
Yeah.
Thank you very much.
Discussion.
So basically, I want to tell you all that it was an actual student from Cumberland University who came to me and told me that she is a nursing student and had a policy class that she wanted to try to put forth some policy that would be helpful to the citizens of Davidson County. So I met with her and I talked to her and I told her that I thought this was a nice thing and something that we should encourage in terms of our city asking for there to be a healthy city. So thus we have 174. So are there any questions or comments? All in favor?
Aye.
And I did let her know that it wasn't necessarily enforceable, but it is a policy for legislation for us to encourage. Thank you very much. So our last bill is 14014, Hancock and Styles, and it is a bill to amend the Metro Code to limit the idling of motor vehicles. Is there a motion?
Second.
Thank you.
And there's
Councilman.
also an amendment.
Oh, yes, you're right. It is an amendment. You want to explain?
It's actually, I'm sorry,
Actually, it's a couple, two,
It's called-
substitute and an amendment.
Move the substitute.
Okay. Do you want
I'd
to,
like to speak on the substitute.
okay, would you please?
So the substitute I created to answer the large outpouring of input we've gotten from the community over the last 2 weeks. And I wanted to let the community as a whole know that we are listening and that we care, that we understand what they're saying, that we're not ignoring them. So I didn't want to just defer the bill and go about our merry way. I do think it's important for the health of society, and I'm glad that this has started the conversation. So I wanted to substitute this bill, which addresses many of the issues that our citizens have brought up, like the extreme temperatures, having an exemption there, applying this to public streets or in public or private parking areas such as parking garages or surface parking lots, not your own driveway, things like that, so that the constituents know that we are listening to them. We also added a provision for that Tom Sharp actually pointed out to myself and our legal team, that this is not a Metro Nashville Police Department enforcement, because this affects air pollution. It's actually a health department, and modeled after one of our states here, Connecticut, that has a no idling policy with no fee. We changed it to no idling with no fee, reporting it to the health department, perhaps via the hub or its successor, and then the person could receive a postcard in the mail with information on no idling, just as we do in Tennessee with the no littering campaign. And if someone is reported, then they receive a brochure in the mail talking about why we don't want to litter and why nobody trashes Tennessee. So what I would like to do is pass this substitute bill so that it's on file, so the community knows we listen to them, and then indefinitely defer and focus on public education through PSAs and working with the schools on the EPA no idling program.
So I just want to be clear. All right, so we're past the substitute, and then you're going to indefinitely defer?
Correct.
Okay.
Should we vote on the substitute?
Yes, are there any more questions or comments regarding the substitute? Yes.
I just want to say thank you for the work that you put into this, and I think that that it is important to make sure that we are protecting our community. So I know the community was very vocal about what they wanted to see, and my suggestion was actually going to be PSAs. So I'm glad to hear that you all are taking that route to do PSA versus legislation. So thank you for the work that you've done.
Absolutely.
What is the benefit of having it as an ordinance as opposed to just a resolution, since the end result will be the same, which will be community education?
Well, originally,
Substitute before we take those.
Oh, okay.
oh, right, yeah.
All right, well, we need to vote on the substitute. All in favor?
Aye.
Any opposed? The
We accept
substitute
the
is moved.
substitute.
So now, any questions in regards to the ordinance itself?
I don't think that if I would have put through a resolution, it would have generated this much community input. I don't think this many Nashvillians would be thinking about idling. So I think it already has made an impact, and I appreciate that. However, I really understand, our public emphasis on education before legislation, as well as the budget problems that we have in Nashville. We need to spend a lot of time and effort on that, and not bring a lot of other, things through the system when we don't need to.
Okay. And you satisfied? And you got any more questions?
I think that a resolution is a better way to go than an ordinance. I understand that we did push that and get the conversation going, and that's good. But
Do you
we
think
got,
we should do that in the future?
yeah, and I think it would be better than doing the ordinance, because the outpouring that I got, at least, about the bill, was very negative about the fact this would be something that was in the code because it was unenforceable and whatever. And I think it had, as good as some of that conversation was, we also had really, really negative pushback that have really turned people kind of off to the whole thing. So I think the idea that this is even something that could at some point come back and amend the code that we passed, come back, I think it got such negative response that I think that a resolution would be, going forth, would be a better way to go. Addressing the same issues and actually the same plan that you seem to have, laid out. I think that would be a more acceptable way to go for people, and they wouldn't feel like something that's unenforceable and encroaching has the potential somewhere to affect their life in a negative way.
Okay. Well,
I
thank
move
you.
to definitely defer this.
Second.
Okay, it's been properly moved and seconded for indefinite deferral. All in favor? Aye. Any opposed? There being none, thank you very, very much, and that ends our meeting. Thank you all for coming.